Good morning, everyone, and welcome to my presentation. Today, I'm going to be talking about how our brain connects with our muscles and how a stroke can affect that connection. Our brain is extremely complex, and within this topic alone, there are many different directions that we could go. So here's a little roadmap that will guide us and give us an overview of what we will be discussing today. We'll start a bit more broad by diving into the connection that the brain has with the muscles. From there, we'll narrow it down a little bit into how stroke can affect that connection. Next, we'll then talk a little bit about tone and spasticity and the common symptoms that we see. Lastly, we'll end with common ways to manage spasticity. If you have any questions along the way, please do not hesitate to reach out. So here we go. Starting off strong, how does our brain work in tandem with our muscles? What is the typical connection between the two that allows the muscles to listen so effortlessly to the brain? Within our bodies, the brain and muscle connection acts like a chain where all the pieces are linked together. This chain starts up top with our brain and includes our spinal cord, our nerves, and finally our muscles. To activate this chain and send a message down the chain, we need to think of an action or movement that we want to complete. Once our brain receives that command, it sends a message down our spinal cord, through our nerves, and down to the specific muscles. Once the muscles receive that message, they respond accordingly and complete that command. For example, let's say that I want to raise my right arm above my head. My brain acknowledges that thought that I want to raise my right arm, sends that specific message through my spinal cord to my nerves, and lands at my shoulder muscles. My shoulder muscles then acknowledge that message and respond by raising my right arm. So step by step, it can look like this. We think of an action we want to complete. Our brain sends the message through our body to our muscles, and our muscles respond with a desired movement. This is what that connection and chain can look like before a stroke occurs. Now that we've established what a typical chain looks like within the body, let's talk about how a stroke can interrupt that connection and what effects the stroke has on the brain-muscle connection. So there are a few different ways that stroke can affect this chain. Firstly, the connections between brain and muscles are damaged. This means that because the chain is disrupted, the brain has trouble sending messages down throughout the body to the muscles. When that connection is broken and the muscles don't receive those signals, a few things can occur. One result is that the muscles stop responding to the brain signals altogether. The brain can keep sending the messages, but because the chain is disrupted and the links are damaged, the muscles just don't receive them. Additionally, an individual might see a change in muscle tone. Tone can either look like a decrease or an change in tone can either look like a decrease or an increase. So moving forward, what exactly is tone? Well, tone can be described as a muscle's response to an outside force, say a stretch or a change in direction. Tone also works against gravity. Gravity is always pushing down on us and trying to get us to fall. Tone helps us keep our balance and remain upright and stable. So sticking to our earlier movement, if I raise my arm into shoulder flexion, tone works against gravity to help keep my arm stable and in the air, and stops it from falling down back to my side. A typical amount of tone is healthy and also allows for adequate range of motion. As mentioned on the last slide, a stroke can have an effect on muscle tone, resulting in either an increase or a decrease. A decreased level of tone can be seen in newborn babies. Within their first few weeks of life, they are still somewhat floppy, you might say. They are unable to hold their heads up, and most often, if they are held on their stomachs in mom and dad's hands, their backs will curve over the hands and will arch. This is an example of decreased tone. Well, the opposite is increased tone, and we can see this in a very common symptom of stroke, and that is spasticity. Well, what is spasticity? Simply put, spasticity is just an increased level of tone. It's a very common result of stroke, and I'm sure that many of you could tell us all about your different experiences with it. So moving forward, now that we've defined spasticity, let's talk about the common symptoms of it and what it can often look like. So spasticity can present itself as extreme tightness in limbs or prolonged muscle contraction. It also might result in loss of mobility around a joint or look like repetitive, jerky movements. Muscle tightness can also be felt. So if you have spasticity in your arm and you touch it, you can physically feel the stiffness of the muscles in that area. If a muscle has what we call prolonged muscle contraction, for example, their arm might stay in the flexed motion for an extended period of time, and it can be really difficult to work their arm into extension because of that muscle tightness. If they are also in the prolonged muscle contraction, they might also experience loss of mobility around that joint. Spasticity can also be described as velocity dependent. Velocity dependent means that the faster a muscle is moved, the more the muscle resists. This can result in repetitive or jerky motions. If someone experiences spasticity in their leg and they accidentally bump it really hard and fast against a table, it might shake and jerk for a minute. That's an example of velocity-dependent spasticity. Spasticity that results in muscle tightness can also be the reason for why it can be difficult to complete certain functional movements. If you have spasticity or muscle tightness within the hamstrings or the back of your thighs, it could be more difficult to stand up since those muscles are really tight and aren't stretching as much as they could be. The same goes for if you have muscle tightness in the back of your arm or your triceps or your biceps. It could be really hard to reach your arm up, reach it out, and if you have muscle tightness within your hand or your fingers, it could be difficult to grasp something. So now that we know what spasticity is, and now we know that what it looks like, we can talk about some different ways that we can manage spasticity symptoms. So there are multiple different routes that can be utilized, 3 to be specific. The first is non-surgical, the second is injection, and the third is surgical. These techniques can be used for different cases of spasticity and can range from very mild to very severe, with mild starting at non-surgical. So starting off with the most non-invasive techniques, non-surgical treatments. When diagnosed with spasticity, these are the first few interventions that a person should try. They can start off by receiving occupational or physical therapy, and we see that option in action here a lot at the American Stroke Foundation. We might suggest different exercises or stretches that you can do at home to assist with that muscle tightness and to help work and loosen those muscles some. The new step is a really good example for how exercises can help with spasticity. By being on the new step and working your arms and your legs for at least 20 minutes or half an hour, you are consistently moving, warming up, and loosening those muscles, which can help decrease those levels of spasticity. If an individual has spasticity in their face or their neck, speech therapy can also be beneficial. They might be able to offer more specific exercises and knowledge that can help with that specific area. Additionally, casting or bracing can be utilized to help stretch out the muscles to reduce contractures. A good example of this is a hand brace. An individual might use this if their hands and fingers are spastic. meaning they consistently curl into a fist and they have trouble extending their fingers all the way outwards. A brace can be worn for different periods of time that can help stretch out those fingers and get those muscles moving. Another option is oral medications. Physicians can prescribe different medications that can act as muscle relaxers to help reduce that muscle tightness and decrease that spasticity. There are certain side effects from these oral medications. The most common one is drowsiness, so make sure that you consult your doctor before starting any new medications. Another side effect is if you are on any other medications, it might clash, so just make sure you talk to your doctor. So moving on into injections. I know this one is also a non-surgical option, but I put it in its own category because I think that it's a step up from the options we just previously discussed. So when I say injection, I am talking about receiving Botox. Now I know Botox is often only thought about when thinking about how to stay looking young and how not to get any age lines on your foreheads. But Botox can be really effective in reducing spasticity. It is also a form of a muscle relaxer, but it is received in injection form. It is injected directly into the muscle with a purpose to assist in relaxation. It can help improve comfort. It can help with improving positioning of the extremity. It can also help improve range of motion and mobility around a certain joint. It can also help with functioning. Botox injections can usually last up to 3 months. And the same with oral medications, they can have possible side effects and can interact with other medications that you're taking, so please consult your physician. So, lastly, there are some surgical options, but these are only recommended for really extreme cases. The first option is a surgically placed pump that goes within the abdomen or the stomach area. Once placed, the pump can release medicine directly into your system. This option can act a lot quicker than oral medication or even injection and will most likely have different side effects. So, where the oral medication might make you really drowsy, really sleepy, this option might not have that side effect. Now, there are a lot of different other effects that come with the surgery on its own. So, that is something to consider if you qualify for one of these treatment options. The second treatment option is an orthopedic surgery. This option deals more with the results of spasticity rather than the muscle tightness itself. Excuse me. So, as with the injections and medication and the stretching, those are all focused on loosening the muscle and helping it get a lot more stretch and relaxing the specific muscle that we're targeting. This option deals with the results. So, as opposed to focusing on the muscle tightness, we're focusing on the fact that an individual is stuck in this contraction. So, an example can include surgically lengthening a tendon to release the arm. But once again, these options are only recommended for extreme cases. So, moving on, I'd like to end by talking to you guys about the benefits of the management techniques and just to provide you with some encouragement just regarding spasticity. So, first of all, the benefits of doing everything we talked about, of exercising regularly, of doing the stretches, of potentially taking Botox or any medications, is you can have increased range of motion. um, these management techniques can make it easier to live with spasticity and just to get those muscles moving and stretched. It can also help um, improve more functional movements. So you might be able to, with these different management techniques, might be able to reach your arm forward or to grasp a cup. So it can help a lot to get to more functional movements. And the last thing is it can help you progress to getting back to what is meaningful for you all. And as BJ mentioned last week, there are a lot of different effects that the stroke can affect. Excuse me. My goodness. Yeah, just as we've talked about previously, stroke has a lot of effects on our mental health and our body, and part of that is not being able to do some of the more meaningful activities that you want to do. And so, spasticity is just a small part of that. But these exercises and these management techniques can help you progress to getting back to what is meaningful to you and doing the activities that you really enjoy. So, that is all I have today. Thank you so much for listening. If you have any questions, please feel free to reach out. Thank you.